This video is an introduction to workflow definition in Kanban. We'll do this through an example of managing patient flow in a hospital emergency room. Kanban's purpose is to optimize the workflow through visualizing work, implementing a pull system, and improving the workflow. Let's see how it applies in this hospital scenario. The Kanban board is a visual representation of the workflow. In our example, the states of a workflow are the different steps the patient scrolls in an emergency room. They start at reception, then they wait to be called by a nurse. Next, they are called for triage by a doctor, followed by receiving the needed treatment. After this, a senior physician completes the validation. Finally, they are discharged. As you see, the first thing to do after identifying these states of the workflow is to visualize it. Now, how can we know when a patient is done with a step? This is part of the definition of the workflow. We'll add exit criteria for each stage. For our example, the exit criteria for reception is that the required patient information is collected. The exit criteria for the state nurse is that symptoms are identified, painkillers are given if needed, and temperature and blood pressure are measured. For triage to be done, the doctor must be identified, the severity measured, and the question, is hospitalization needed? Answered. Treatment is done when all required treatments are completed, for example, X-ray, lab work, medication, operation, or hospitalization. Finally, validation means that a senior physician has validated the treatment. Kanban operates as pull system, meaning that work is only moved to the next stage when the person or team in charge feels there is capacity to work on it. It is a good practice in a pull system to have ongoing and done columns for each state, as this clearly distinguishes work that is actively being processed from work that is ready to move to the next stage. Once this is done, we'll want to define how to limit the work in progress, commonly called WIP. But first, what is work in progress? It is any item between a starting point and an end point. This means that we must identify the starting and end points. In our example, we'll have two starting points. The first one is when a patient arrives at reception, and the second is when triage starts. These serve to measure different metrics, like WIP and throughput. We also have two endpoints, when validation is done and when discharge is done. This said, we'll define how we want to limit the work in progress. Limiting WIP can be done by setting a limit for a single state, like nurse ongoing. It can also be done by setting a limit for multiple states, like treatment and validation, or from nurse to validation done. Why is limiting WIP important? Limiting WIP reduces multitasking, minimizes bottlenecks, and ensures the team focuses on completing work instead of starting too many tasks at once. It improves flow, reduces cycle times, and creates a smoother workflow. After this, we'll add some explicit policies. These can include rules such as when to expedite an item, when going backward is allowed, or how to handle blocked items. In our example, two key policies are noted. Patients can move back from validation to treatment if the senior physician doesn't validate the treatment. Patients with a severity score higher than 3 are expedited to ensure timely care. These policies create clarity and help the team make decisions quickly, even in high pressure situations. Finally, we'll set the service level expectation, SLE. It is the forecast of how long it should take an item to flow from start to finish. It comes in the form of a probability. In our example, it is 85% of the patients move from start 1 to end 1 in 5 hours or less. The SLE helps answer the question, How much age is too much? In Kanban, work item age is defined as the elapsed time since an item started. Spoiler alert. This is the most important Kanban measure because it helps detecting aging items that may require intervention to ensure timely delivery. Kanban is not just about defining the workflow, it's also about improving it using insights from measures like work item age, throughput, wipe, and cycle time. Continuous improvement is central to Kanban. By regularly analyzing metrics like cycle time and work item age, teams can identify bottlenecks, refine processes, and adapt to changes, ensuring ongoing optimization of the workflow. To summarize, start by identifying how your value items flow through the system and the exit criteria for each stage. Define your starting and finishing points. Decide how you limit WIP in your workflow. Explicitly define your policies. Finally, set your service level expectation. By implementing these practices, the hospital ensures that patients receive timely care, reducing delays and improving overall outcomes both for the patients and the medical team.